in terms of our health situation. So can anyone tell me, what have you heard in the news recently that you think we need to be aware of? Maybe you need some more information about those things happening, within Nigeria as per the health of the people, or even maybe Africa, West Africa. Is there anyone who has come across something? Pardon? Ebola, yes, that's one. Any other one? Lassa fever, okay. Any other one? Ma? Okay, mommy says meningitis. Yes, meningitis has been with us. All right, so this morning we just want to talk about the viral outbreaks that have occurred around us in recent months, and talk about how these can impact our health and the preventive strategies we can take. We shouldn't be ignorant of what is happening around us. Sometimes until it affects someone that is very close, we don't realize that this thing is near to us. But we really thank God for his mercies. I remember that during the Ebola period, maybe it was at 2016 or so, you remember the crisis that it caused in this part of the world, but the Lord, had mercy and delivered us. So today we're going to be talking about these recent outbreaks, and we have three major ones that I'm going to talk about. They are viral outbreaks. We have Ebola virus disease, we have Lassa fever, and we have hantavirus. Some of us may not have heard about the hantavirus, but what is really common to these things, these three viruses, is the mode of transmission. So it's important to understand how these diseases occur, where they are located presently in terms of occurrence, how they spread, the symptoms, and how to prevent them so that our families and our communities are secure. The grace of God has been sufficient for us, but whatever is within our power, because God has given us a free will, and some of the things that we are seeing that have affected man are actually due to our own activities and not being able to control, some of our own habits. So, talking about Ebola virus, it has been known over time, to occur within the Democratic Republic of Congo. That's the DRC. That's where it typically started from. And in recent times, it has spread to Uganda. So I was looking at some of the statistics, that were shared by the WHO, and they were trying to talk about how many people have, let me open that document, how many people have developed this Ebola disease. And they've listed the number of people who have developed the disease and how many people have actually died from the disease. Well, by the grace of God, there are not so many, but they said as at May 15, 2026, a total of 246 suspected cases were reported in the Democratic Republic of Congo, and 80 deaths. So if you look at the fatality rate has to do with the number of people that die from the disease. It's high, so it's better not to even get the disease at all. In Uganda, it's less. I think in Uganda, they've just reported maybe about 7 deaths, in Uganda, and a lower number, of cases. So it's something that we need to talk about, because the world is like, you can just pass in from one city to the other, one plane flight, within 2, 3, 4 hours, you have landed. And we know that a human being is enough, to carry the disease from one country to another. So how is Ebola spread? Ebola is spread through direct contact with body fluids. And what is the most common body fluid? Blood. Blood or fluids. It can be fluids from semen or vaginal secretions. It can be from nasal secretions. And I'm sure you remember that there was a time we had to use masks, we had to avoid shaking and all of that because of the risk of infection. So infected persons can transmit that way. Then contaminated surfaces and objects. So if someone who has a virus, leaves secretions, on a surface and someone else touches it and takes their hand to their face or to their teeth, especially for people that put their hand in their mouth for some reason or the other, they are at higher risk. Infected animals such as bats and non-human primates. Do people eat bats? No, people don't eat bats. Okay. Bodies of individuals who have died from the disease. So if someone comes in contact, I think the body is even like the dead body is like one of the most infectious ways of transmitting the disease. What are the symptoms? Sudden fever. There are so many things that cause fever. Malaria fever, typhoid fever, meningitis can cause fever. But it causes a sudden fever, severe weakness and fatigue, headache, joint pains, muscle pains, sore throats. And then it progresses very quickly to cause vomiting, diarrhea, abdominal pain, rashes on the skin, and bleeding from different sites in the body. So that's one of the common things. And then when it comes to Lassa fever, because they have similar presentations, Lassa fever is endemic, in Nigeria. And the states that have been affected, particularly we have Ondo State, Bauchi, Edo, Taraba, and Ebonyi states. So we have quite a number of people who have been reported, to develop Lassa fever. The death rate is not as high. The fatality rate is about 1%, when it comes to Lassa fever. But how is it spread? Contact with urine or the droppings of infected rodents. There's a particular rat. That rat has breasts on this side and this side. So they call it Mastomys natalensis. So it has double breasts along the trunk. So that is the rat that is responsible, for transmitting the disease. So the rats, they can drop their feces in different places, and that's why our hygiene is so important. So consumption of food contaminated by these infected rodents. For example, people that are making gari, from cassava, and they spread the cassava or whatever they have blended on the road side in the sun. What would happen is that there are some rodents that will go there. Of course, lizards can go there, but if this particular rat goes there and leaves a drop in there, and people consume that food, they can be at risk of Lassa fever. Person-to-person transmission as well. So that's why healthcare workers are also, they have to pay very close attention to infection control in the hospital. In fact, when people come to my own department in family medicine in LASUS, we always tell them wear a face mask. Of course, we don't tell them to sit apart like we did during the COVID-19 period, but we try to raise that awareness in health talks for them to know that, see, people who are sick come to the hospital. So when you come to the hospital, don't behave as if the person next to you is fine. I remember that one of my registrars called my attention to see a patient at some point because the patient reported fever and then bleeding from the nose. And the history showed that this person had traveled, to one of the states. I can't remember what state it is now, but one of the states where there has been a history of the breakout, of Lassa fever. So, of course, for that person, we had to quickly escalate. The patient was transferred to IDH, that's the infectious disease hospital, where it could be, isolated and then monitored to be sure that if contact tracing is needed, people around him, and so that whatever it is doesn't just spread. So a high index of suspicion is even needed for health workers. What are the common symptoms? Very similar to Ebola as well. Fever, weakness, headache, sore throat, muscle pain. So you can see that the symptoms are similar. And then when the disease has progressed and becomes severe, we have swelling, facial swelling, vomiting, chest pain, bleeding. So the same pattern of bleeding can occur. Then the third one that I said we'll talk about is hantavirus infection. So hantavirus infection has not been reported in Africa, but it has been reported in other countries in North, South America, Asia, and Europe. And it is less common. I think the first time I heard about hantavirus was this year. And how do people become infected? The people become infected by breathing in air that is contaminated with the urine of rodents. So rodents are implicated in all these three infections. The droppings of these rodents, contact with the saliva, the droppings or the urine of these rodents, contact with contaminated surfaces. But the only thing that has been noticed is that the human-to-human transmission is not as common as it is in Lassa and Ebola. What are the symptoms? Fever, headache, fatigue, muscle aches. Later they can develop cough, shortness of breath, accumulation of fluid in the lungs, which will lead to respiratory failure. So we've talked about these three viruses. What are the prevention strategies? Because the strategies are actually very similar. And I will just talk about how we can control each of these viruses, even though they are very similar. So the very first one is Ebola virus. So to control Ebola virus, even though it's said that there are some vaccines available, but I'm not sure how widespread the vaccines are. However, to prevent, the first thing is frequent hand hygiene, hand washing. How many seconds are required to wash our hands? 20 seconds, yes. Let's clap for mommy. Mommy remembers. Because we've demonstrated how to wash our hands, and we can achieve that by singing what? What can we sing? We can sing happy birthday to ourselves, even if it's not your birthday. If you want to check, you sing happy birthday for yourself, and make sure you wash your hands thoroughly under your nails. That means we have to keep our nails trim. Avoid contact with body fluids of infected individuals. So that can be achieved when we go to the hospital. We make sure we cover our nostrils with a face mask, and we make sure that we don't touch things anyhow, especially surfaces within the hospital. Prompt isolation of suspected cases, just like we did for that person who came to our clinic. Safe burial practices. We know in some parts of the world, some people will still touch the corpse, fall on the corpse, so as we've noticed that when people go for burial and come back, they can actually come back with that infection. So that's why it's very important that people who are burying their loved ones, they ensure that there is no contact, with the body of the person who is being laid to rest. And then healthcare workers, there are protective equipment that can be used, from the face mask to goggles and some other attires, and then community education. So that's why we're having this discussion, so that many of us can be aware, we can keep ourselves abreast of what is happening. Then also very importantly is keeping our homes and surrounding clean. And that's why environmental sanitation has been promoted by the government, a lot of times, but it's really left to us as individuals and families to ensure that our homes are clean and tidy. because if they aren't, then definitely rats are going to visit us, and hopefully the Mastodis natalensis rats will not visit us in Jesus' name. Then we should store food in rodent-proof containers. I learned that rats now eat plastic. I don't know how true it is. They eat plastics. Highly nutritious for them. Wow. So God will give us more strategies to ward them off in Jesus' name. Then we should avoid drying foods on the road where rodents can contaminate them, like I mentioned earlier. Good hand hygiene, washing our hands frequently when we go out and come in, and of course we should avoid touching our face and using our nails to do things in our mouths. The medical settings. In medical settings, there are also recommendations which might not necessarily apply to us, but people who work in the medical setting have to also ensure those prevention strategies, cleaning, avoiding contamination and spread from one person to the other, because a health worker can actually spread an infection from one patient to the other. So there are other things that we are supposed to do. So we should prevent rodents from entering our homes and workplaces. We should seal cracks and openings in the buildings where we are so that rats don't come in. We should store food properly, maintain environmental sanitation, and then we should avoid sweeping rodent droppings directly. So if you have to sweep droppings, make sure you wear a face mask so that you don't inhale any of those things. And then if you are thinking that this is a contaminated area, use gloves as well, use disinfectants. So despite their differences, these viral diseases, they share important lessons. The first thing is that early detection can save lives. If you have symptoms you're not sure of, don't just go over the counter to get medication. Be sure that you are seen properly. Good hygiene is our strongest defense. And then environmental cleanliness and community awareness. So in summary, we've talked about the places where Ebola disease and Lassa fever and hantavirus have been reported. We've talked about the mode of spread, how we can curtail transmission from one person to the other. Above all, let's maintain hygiene, both within our individual spaces, within our communities, and we know that the grace of God is always sufficient for us. So if we have any questions regarding this or anything that we have discussed during the course of the year, whether it's hypertension or any other thing that we have discussed, please write down your questions and pass them to the front during the course of the audience with the King. Thank you very much for your attention.